Hey everyone, welcome to another edition of the Right Way Wednesday. Today I have Lori Bunch. Hi, Lori.
Hi.
She is a rehab director PTA from Holly Hill. Where are you in? Where's Holly Hill?
So Holly Hill is in Newberry, Ohio.
Okay, Ohio. All right. And so Lori is one of our rehab directors, and one of the things, and I remember from being a rehab director, is I still think this, and I've done a lot of different jobs within the company, that the rehab director job is probably one of the most hardest positions, most difficult position, not most hardest, that's not even a thing, most difficult positions, because you have to shift gears so much, right? It's difficult because you're managing, you're looking at metrics, you have so many people that you need to report to, and you're just really shifting gears between that operational aspect and then the clinical treating aspect, because you're still expected to treat patients, right? So, I wanted to talk a little bit about that, because I think that's a universal struggle for rehab directors and even clinicians out there too, because they play sometimes a lot of different roles, even if you're not a rehab director in each building. So, thinking about that and your requirement to shift gears a lot, what are a couple of things that you've done to help you take care of those administrative operational duties without compromising patient care?
Yeah, so probably forefront is I always keep a running to-do list. And this to-do list, again, is just ongoing. So I'm constantly adding things to it and then check marking things off of it. And it helps me do, number one, it helps me just make sure that I don't forget anything. And then also, it just helps me prioritize. So as I create this running to-do list, I can, at the beginning of my day, or typically at the end of my day for the next day, I'll review it and then I'll prioritize my tasks that are ahead of me.
Okay.
But also, oh, go ahead.
No, go ahead. Yeah.
Okay. So also, I work hard scheduling all of my patient care around webinars and care conferences and any kind of meetings, expectations that HealthPRO or the facility have on me. But also in the same breath, I just want to say that I've worked hard teaching the facility staff how important patient care is to me. So they know that when they walk in the therapy room, if I'm one-on-one or if I have a group going on, that is my priority. So unless it's an emergency, they just leave a message at my desk and they know I'll get back to it as soon as I can.
Yeah, and that's really important. That's one of the hardest things, I think, for some teams to sort of kind of get in the habit of doing. Yeah.
I've had to set the boundaries, but they've been very respectful. They get it. And then probably the third thing that I do is just recently really embracing group and concurrent treatment. I just feel like for me personally, it creates flow throughout my treatment sessions and truly is a win-win. Not only do my residents love it, they benefit highly from it, but also my productivity overall has increased probably on average like an 8%.
Oh, that's awesome. That's really great. How has your team reacted to these strategies? How have they incorporated those? Have they incorporated those into their day as well? Tell me about that a little bit.
Yeah, absolutely. Some people have the running flow of a to-do list, but also some other people love sticky notes. So whatever form of communication is, typically it is written down, which I absolutely love. So at any time, if you take a peek at my desk, there are sticky notes everywhere, which again, I embrace. But if I have to comment on one thing, it is the group and concurrent. They have totally embraced this method in this form of delivering treatments to our patients. They identify a couple things, not only the benefits. I will tell you, when any staff member from the facility is walking by and we have a group going on, the energy and the light that is coming from the therapy room is undeniable. And I will tell you, even sitting in a morning meeting, it is mentioned over and over again how awesome these groups are that we're providing our patients. So they get that. And also, I think part of the success for our group and our concurrent treatments is that they are so supportive of each other, my team members. They know that when a group is going on, nothing else trumps, and that we support each other by helping transport the patients and just making sure that they have their time and their space to complete that group.
That's really awesome.
They've been good.
Maybe we can get back together again and talk more about that in particular, because that is a hot topic these days. You know that.
Yes. For sure.
So tell me, what if you could say one thing to a rehab director or a clinician out there watching this? What would be your the most valuable piece of advice when thinking about what we've been talking about? What would you tell them?
Yeah. So, as a new rehab director and managing your time, I think one thing that I've learned is how to delegate to my team members, and that starts by identifying the strengths in every single one of them. And when you identify those strengths and you begin to delegate, I will tell you, your team members will value that and appreciate you're giving them opportunities to participate in this team setting. And as a manager, our ultimate goal is to build a successful team. And I'm telling you, that contribution, that back and forth will build the trust that we need for that successful team. And then probably one other aspect I want to share is just allowing yourself not to be perfect on every little thing that you do. As we talk about the to-do list and we're working through our to-do list, do it so it's good enough. I mean, that way you work on through. If you only focus on one or two of your tasks and you're trying to strive for perfection, you're never going to get to the rest of the list of the items that you have to do. So making them great, making them good enough. And then at the end of the day, if you want to circle back around to add a little bit more or contribute a little bit more to certain tasks, you can. And I think ultimately those things have helped me walk away every day knowing that I found great balance with providing excellent patient care and being a dynamic team leader and also representing the therapy department with grace.
Yeah, that's awesome. Thank you. Thank you so much, Lori. I appreciate you sharing your insights. I think it's just invaluable to hear how you guys are doing out in the field and what you're actually implementing into your day-to-day practice. So I really appreciate it. Thank you.
Thank you so much for having me.
Sure. If you have any questions for Lori or for me, let us know in the comment box below. We would love to hear from you. Happy documenting. Thanks so much. Have a great day.
Bye-bye.